Greetings my friends, today we're going to instruct how to do exercises during a pregnancy. Here's my patient and my friend Natasha, and thank you for agreeing to participate in this video, we really appreciate that. So we're going to show how to do exercises during a pregnancy, and they may look like regular exercises, but they're modified to make sure that it's safe and not strenuous for the pregnant woman. So the reality is very simple. Those exercises look and feel identical to regular exercises, and we want to make sure we break this barrier, because there's a stigma going on in the world that if you're pregnant you don't do this, don't do that, and it actually applies more pressure on the woman and makes her life way more complicated, risking more miscarriages and more troubles during the pregnancies. Therefore, we're going to minimize that and make sure that we do it as safe as possible and as easy as possible, okay? So, awesome. We're going to start from the warm-up, so just stay relaxed. Every day when you do some exercises, always start with the warm-up. So let's start from the neck, and it's very simple. Let's just turn the head side to side, just like this, and to the other side in a very gentle way. And if you feel dizzy, you can just do it in one side only. So let's just turn to the left side only and turn to the neutral, and you can do 3-4 times one way and then do it 3 to 4 times the other way. And by the way, you can pause at this step at any time and continue doing them as much as you need feel to be warmed up and so on and so forth. Okay, so now we're going to do chin down and to neutral. Chin down and to neutral, chin down and to neutral, and we'll go back. Point your chin up, trying to open your chest, and down to neutral, keeping your chest open. Chin up and to neutral, chin up and to neutral. And now we're going to do side to side, ear to shoulder. You can come back to neutral, or you can do it both ways at the same time. It's very simple, just don't get dizzy. Don't collapse on yourself, and if you feel dizzy, just do it in one side, like we're gonna do to the left, your left, 3 or 4 times. Your left. Your left. Yeah, and it's okay if you mess up sides, don't worry about this. The truth is that you can do both sides at the same time. Meaning, like, if you do 10 times to the left, do 10 times to the right. Make sure you're balanced and equal, okay? So if you do it one way, then, you can do it 10 times one way, and then let's do to your right, my left. And because we're mirror image, and sometimes, people get confused. And make sure you do exactly the same number of repetitions to both sides equally, right? So we finished with the neck warm-up, we did it in all different directions. Now let's do it with the shoulder. So just twist back 3 or 4 times. Oh, I hear some cracking noises in the shoulders. That's okay, don't worry about this. It doesn't mean it's injury or anything good or bad happens. It's just noise in the joints. Those, air pockets, they just released, and then they create those popping sounds, and sometimes tissue going over now forward. Again, 4, 5, 6, 7 times. As much as you feel like you're getting loose and warm up, because every one of us is different, and for one person 5 or 10 times it will be enough, for another person will be 10 or 15 is enough. So also you can do with straight hands. I'm going to step just a bit back, and you can do it also with the straight hand. Just motion forward like you're trying to swim butterfly, and you're trying to swim backward butterfly. The most important, Natasha, while you're doing these exercises, I don't want you to feel exhausted, okay? Because this is not about make you tired or fatigued, because that's when the most challenges comes up. It's when you feel tired or anything, just take a break as much as you need it, and then continue. And those instructions applies to you as well. I'm giving them to Natasha, but I want to make sure that you're clear on that. It's not to exhaust women. It's not to make her worked out. This is not a workout per se, get her tired. This is workout to make her stronger, preparing for the pregnancy, for easier birth. And in fact, I always encourage you, find yourself a good chiropractor and be under regular care of the either doula or midwife or OBGYN, obstetrician and gynecologist, that obviously monitors your health from all other perspectives. So we're gonna do waist warm-up, so just tiny gentle rotation of the shoulders clockwise, and then we can do counterclockwise 5 or 10 times. And at the same time, chiropractic is awesome in terms of minimizing the distortion. This is documented actually that it helps to have easier birth, faster birth, less pain and less interventions used. So as soon as you feel like you warm up, you can stop, and then we can do hips right now. So you can just do rotation to the right. Yeah, awesome. So let's do rotation. If you feel like unbalanced, you can hold the wall. You don't need to do it all standing. So you can get the chair. I want you to feel comfortable while doing this exercises. So hold the wall, or if you're comfortable standing like this, put your hands on your waist and just raise your leg and do the rotation of your hip outside. And I hear lots of clicking in my hip just because it's been overtrained with all those marathons and running and all those things. So it's good for me too, even though I'm not pregnant. Yeah, and then let's do the other leg. And by the way, if husbands are watching with your wives, they can participate in that too. I can tell you, wives really appreciate when husbands experiencing close to the same what they do. Thanks God, man, you don't have to deliver. I'm really blessed for that. Alright, so when we finish our hips workout, we can go and start working on our core exercises. That's what it's all about today. On top of the regular core stability that we teach here, I'm going to show how to make primarily this area strong, because that's what you're going to use during the pregnancy. That's what you're going to use during the birth process. Therefore, we want to make sure that by the time you get to the delivery time, those muscles are strong. Okay? And therefore, the stronger the muscle, the easier birth. Alright, most exercises should be done on the floor. It helps to stabilize our core and at the same time provide stable surface. I recommend to use yoga mats. This is really important, and use the hard floor surface. Try to avoid carpeted areas or softer areas. Okay, so what we're going to start doing, with lying down on the back. I'm going to start showing. Just watch it first. So your hands are down, you can put them along and use your hands as a support. If you're not strong enough, you can use them as a support. So what we're going to do, first we're going to start engaging the core. So basically contracting the muscles of your belly. This is the simplest way. And then we're going to go by raising the shoulders only. So you can cross yourself and just raise your shoulders. Make sure that the head and the shoulders are locked. And you're going to start slowly doing this. Alright, so Natasha, let's lie down on your back. Keep your legs closer to your belly. And start contracting your abs, your core. But at the same time, not doing it by the breathing, but by the muscles. Try to desynchronize your muscle contractions from your breathing. So, contract and hold, and keep breathing, and relax. Okay, contract your muscles, keep breathing normally, and relax. This is so important that we know. It is so important to desynchronize your breathing from the muscle contraction, because we are not doing it based on your lungs pressure in abdominal cavity. We're doing it to make your muscles stronger, okay? So therefore, all exercises, ladies, this is 100% necessity that you desynchronize your breathing from the muscles contraction. Your muscles has to be strong, and that's what we're doing it for. So contract, hold, and relax, and keep breathing normally. Contract your muscles and relax. Yes. So now we're going to do raising your shoulders. All right. So cross your hands over, exactly, and breathe normally. Don't try to synchronize your breathing in the exercises. Okay. Just breathe normally like you do, and raise your shoulders and your head slowly. Nice, and relax. This is dynamic mode. Come on, let you keep doing it and relax. The most important thing that you do it within the level of your fitness, because we're gonna build it up. And when you feel exhausted, let me know. You can stop at any point. So this is dynamic version, so when the person is moving and relax. And the static is when you raise it and hold it. And I suggest to relax your head, just relax your head, look up at the ceiling, just like this. And that holds your muscles still. And hold it for 10, 15, 30 seconds as much as you can without applying lots of pressure. Make sure you're breathing normally. That's the most important thing, that your muscles are working independent of your breathing. And when you're tired, you just relax and take as much time as you need it. And we're gonna go forward with this. You can do this exercise, multiple sets, take enough time in between. So the next exercise I'll show you is the plank. So plank is helping us also to stabilize all those muscles. We're gonna do it on the knees. If it's too tiring on the knees, you can just raise in a little bit, and let me show it to you, Natasha. So if you're gonna look here, we're gonna start from this position, lying down on your belly. And if belly is too big, ladies, because belly gets big, so you don't need to lie down completely, you can do it from this position. So if you have a belly, if you're second or third trimester, you can just go forward and lean forward, just like that. Just like that. And you can also raise your legs like this. And that's all you need to be doing, and that will allow to have a good work on stabilization of the core. So let's do it, Natasha. So let's pretend that you're in advanced stage. Natasha is only in the first trimester. So, and just slowly walk forward with your arms, yeah? And until you keep your hips and torso stretched. That's it, that's all you need to be doing. And what else you need to be doing? Not just trying to hang, but maintain the posture, just maintain it. Tuck it up and squeeze your shoulders blade. Nice. Yeah, and you can lower your pelvis a bit lower. Here we go. That's engaging the glutes too. Those muscles, the big muscles at the back of your thighs, that's helping too. And you can do it in a static mode, or you can do it in dynamic, just slowly going up and down, just tiny bit, up and down. And then we're gonna go on the quads, and we're gonna continue the set of exercises. So when the plank is done, you can raise one leg, just raise one, stretch your leg, just like this, and hold it for 10-15 seconds, and relax. And then you can use another leg, raising it up, hold it for 10-15 seconds and relax. So we are working these gluteal muscles that are big stabilizers for the core. At the same time, core is engaged. And you can do it dynamic way when you can do a multiple repetition with one leg. 1 and 2 and 3 and 4. And you can alternate as much as you need it. And you can do other leg. So that's working on the stabilization of the pelvis. Okay, and relax. Okay, now we can sit down. And in this situation, in a sitting situation, we can work Kegel exercises. Kegel exercises, it's the pelvic floor muscles that are basically holding the pelvis right at the bottom. So in this exercise, you're just trying to squeeze your glutes and contract them and relax. Squeeze and relax. So what it does, you have to feel like a feeling almost like you raised up and down, raise up and down. So this is the exercises allowing the pelvic floor muscles to become strong, and at the same time learning how to control those muscles and just breathe normally, because this allows you to have a strong muscles and not to push it by using your lungs, applying abdominal pressure. That's where people compensate the lack of muscle strength with the pressure of the air in the lungs, and this is not going to work ever for a goodness of the delivery. Okay, so just relax. Again, repeat 15-20 times as much as as you need to contract it. Are you feeling okay? No,
Yeah,
you don't
okay.
need a break? Okay, awesome. So next we're gonna do a side bridge. So this is very, very simple. We're gonna lie down on the side, and I always keep in mind, because for me, like almost I need a pillow, you know, to imitate that you're pregnant. So try to comfortably position yourself on the side, and legs are bent, and you can just hold the side bridge. So again, it's done in the static or in dynamic mode when we're doing multiple repetitions. All right, so I'm gonna ask Natasha to do the side bridge. So gently get in the position, just elbow down. Make sure that the body is stretched, meaning like it's straight in the hips. So bend your knees, just like that. So we are maintaining the normal posture. So the shoulder and the hip and the knee should be in one line, and then the head is in neutral, looking forward, and we are raising the pelvis, just raising the pelvis. Yeah, she is so strong. You can put it on your hand like this. Look, she's so strong, she can do it almost on her feet, even though you can do it on the knees. Just raise it on the knees. Yeah, just like that. This is basic, simple, and just to hold it statically, or you can do it dynamically, slowly. It's very important to have a good control over your motions. Don't ever drop it, and don't try to, you know, do a jerk with your exercises. Or if you're strong enough and you're not exhausted, you can do it like Natasha did, stretch your legs, and you can do it full side bridge. Yeah, so you can do full side bridge. And you can do it same static or dynamic way, so when you can go up and down, up and down. Okay. Yeah, okay, so if she's exhausted, I'm not gonna force it, because remember the whole idea that the woman has to get strong but don't exhaust herself, because that's when the problems come in, and that's when we get injured, including pregnant or non-pregnant. That when we are tired. Tiredness gives the injury. So and I'm allowing Natasha just take enough time, breathing, relaxing, and obviously do it on both sides. So if you can roll over on the other side, and we can do it also on the other side, because we have both muscles on right and left, they're 100% symmetrical. So again, we are placing the position when the shoulder, hip and the knee align, and this hand can go down, it can go there, wherever you feel comfortable. You can actually use it like Natasha did as a support hand to help to train those muscles. And do it in a dynamic way, or just raise it up and hold it. And keep breathing normally, keep breathing and holding it. It's very important again to desynchronize your breathing and emotion, because when you are pregnant you still need to breathe and the contractions are coming, and you need to push, you need to use those muscles and relax. Awesome. So next exercise, when we're going to do sitting down, when we in yoga it's called cobbler pose. So when the legs are open, so move your heels and sole of your foot to foot, and you having grabbing your toes at the ankle level, and straighten your spine. Slowly just try to relax your knees that they're going down, and gently push yourself forward, but don't try to bend down this way. Keep your spine in neutral, just gently push forward a little bit, and it will help you to open up the hip area here in the front and there at the back. The way when you're trying to deliver the baby, the floor is relaxed. So what I want you to do, I want you to focus on the flexion, but at the same time relaxing your legs. Like it's an exercise that requires a concentration in both ways. It's when you need to working on bending forward and at the same time relaxing your legs, relaxing your pelvic floor. I know it requires some training, that's why we better start earlier with these exercises, because it's going to take you 9 months to get prepared for this process. So the earlier you start, the easier it's going to get. So gentle and gentle and gentle. And again, trying to relax your knees that they're gonna go down, and push yourself gently forward without collapsing your spine. And let go. And now we're gonna work on hamstrings, because hamstrings muscles, those are muscles at the back of your thigh. They're attached to your pelvis, and therefore you want to make sure that all of those muscles are flexible. So stretch one leg forward and another leg in the figure 4 position. And you can use bell, towel or anything like this, so you can use your leg, and with your straight spine just try to bend like a hinge in your pelvic, in your hip joints, and trying to go forward. Yes, make all necessary adjustments that you need and just bend gently forward, and don't force yourself. You need to make sure that you just relax and breathing, but at the same time you feel the stretch in the back of your leg, right? Yeah, and try to go a little bit farther each time you do it, but don't overkill yourself. Remember, when you're pregnant, your body is getting ready for delivery, so all muscles, all joints become slowly a little bit looser. So we have this hormone relaxin that is secreted slowly in the pregnancy, and way more right before your birth, to allow your joints and muscles to become loose in order to open the pelvic floor outlet for your baby to go through. So make sure when you do those exercises, you're not experiencing extreme ends, extreme forces, because we don't want your ligaments and joints just to snap. So each stretch, hold it for 30 seconds, then we're gonna switch the legs, because you have 2 legs, 2 hamstrings, 1 pelvis but 2 bones. And again, take a deep breath in and keep your spine straight, and with the straight spine go forward, and you can feel the stretch right in the back of your thighs. It's called hamstrings muscle. So after we stretch our hamstrings, it would be easier for Natasha to raise her legs up, and that's the next exercise. Yeah, and we're excited. So hold the stretch for 30 seconds. Again, don't push yourself so hard, but you still have to feel some stretch. And the breathing should be completely free. Just breathe like you normally breathe. But learn to contract those muscles or stretch those muscles without using your breath, without using your forces. Okay, so just use exercises to train your muscles. You want to make sure that they're conditioned well. I mean, they're strong and they're flexible. Alright, and after 30 seconds pass, we're gonna go on the back. So we're gonna do touch the sky exercise. So when we're lying down on our back, and you can do it both. You can do it either legs on your toes, on your flat foot, or you can raise your legs up. Because we stretch our hamstrings, we can do it raising up and just sustain it. So there are a few more exercises left, and we want to make sure that you get them all. So I'm gonna ask Natasha to stand on the knees like this. You can split your legs a little bit wide, yeah, and just lean back and forward. This is gonna work on your quads muscles. They're really important. And forward. At the same time, when you do this, you're probably feeling like your abs are working a little bit too.
I'm feeling more here.
More here, yes. That's where the primary exercise is for. But at the same time, you're probably gonna notice that your abs are working as well, because the lower you go, the more it's gonna be activated. So, but this is very important for your quads strength, because quadriceps are attached in the pelvis, and just gently do that exercise. And you can also do it in a static mode, so when you just lean back and hold it and breathe, just breathe naturally. And if it's tough for you, you can put your hands on your heels and go lower, just like this. And when you get off of this pose, I don't want you to push it forward, just sit down and then you get up. if you need to, alright? So we work those quadriceps muscles, now we want to stretch them. So stretch is very, very simple. We can actually sit down like we were doing a side bridge, and I'm gonna show you first, like we're doing the side bridge. Then you take the knee and you basically push your heel to your buttocks, and then you're gonna stretch this quadriceps group. And at the same time, try to move your pelvis forward, your pelvis moving forward, and keeping your core stable. Alright, Natasha, let's do it together. So let's get into the side bridge position. On the side, yeah. Then keep your pelvis forward and bend the heel, one leg, yeah. And grab your ankle. Yeah, perfect, just like that. And if you move your pelvis forward, you feel like this tension getting stronger, right? Yeah. Yeah, so this is quadriceps stretch. And hold it for 30 seconds and slowly let go. And then do the same for the other side. So let's roll over on the other side. Oh, that's awesome. That's gonna be showing you how it looks from the back. So person is stretched, heel to the buttock, and the arm is taken for the ankle, and the pelvis is moving forward. So we're stretching the quadriceps, which is in front of your thigh, and we're holding it for 30 seconds. And gently release. Alright, so we would like to continue being active during your pregnancy, because we just shown you the basic exercises here, but you can also advance in the high level, and hopefully in the future videos we will describe for different people who has higher fitness of level, then they can do more. And I encourage you, Natasha, don't stop your life just because the pregnancy happens, right? So I encourage you to be active. So we're gonna do some squats, and also for the muscles of the legs. So split your legs a little bit farther apart than your shoulders level. Make sure when we're doing the squat, your knee are not crossing your toes line. So, and then we're going to do very, very simple. You can hold your hands like this, you can hold your hands on the waist, or you can hold your hands in front or above, anywhere you like it, wherever you're comfortable, or you can do a motion with the prayer. So we'll start together like this, so we can squat, like you're trying to sit on the stool, and gently go up. And squat, and when you squat, try to go as slow as your thighs are parallel to the floor. Yeah, and go up. And then you can do it in a dynamic mode, the way we're doing this. And when you raise up, I want you to squeeze your gluteal muscles just to push your pelvis forward. And then go down and up. And go down, and let's stay down. And then when you're holding down, make sure you breathe. Okay, just breathe, relax. If it's tiring, you can put your hands on your thighs like this, and you will have a better control and easier a little bit on your legs. And at the same time, you can do your Kegel exercises. So contract your pelvic floor, squeeze it and relax, squeeze it and relax, squeeze it and relax, and go up. Awesome. So do it 10-15 times in the level of your tolerance. So now, since we're standing like this, I'm going to show how to do hamstring stretch in a little bit different position than sitting down. So we're going to turn one leg outside, that the heel is basically pointing right in the middle of your other toe. Now let's turn your pelvis 90 degrees. You can scoop your leg a little bit. Yeah, just scoop your leg a little bit. And with the straight spine, without bending your spine, we're just doing flexion at the hip joint. We bend forward and put our hands down. It will push a little bit stronger with the hands hanging down. And we feel the stretch right here, right? So breathing normally, Don't try to force it. Now we're doing stretch. I always suggest in a pregnancy, it's a little bit different rhythm, doing strength, stretch combination. Strength, stretch, strength, stretch, strength, stretch. Because you want to make sure that woman is not exhausted during the exercises, because this is a big safety issue. So when you finish, the knee goes forward, and then you go up. And then we can twist in the other side. Same, just tiny bit of gap, approximately half or the size of your normal step. And pelvis is square, just as Natasha showing it to you. And we go slowly forward. Great. And you can either keep your hands right where they are or just let them loose and hang. Make sure you're looking right in front of you. And this way you can feel like stretch is happening at the hamstrings of the forward leg. And hold it for 30 seconds to a minute. And let go. And the final exercise I want to show, it's actually wrist coordination, so breathing. So I'm going to show you first. When you're doing a squat and raising your hands, you take a deep breath in. And then we're going up. Let's do it together. And try to split your knees apart, like to the side. And if you make a wider stand, yeah, it's gonna help you to do it better. And breathing. And do it 5-10 times, and when you finish, relax and just relax your hands, open your shoulders, and you can pat yourself. Good job. You did a good job. Thank you so much for participating in this video. We hope that it helps, ladies, for you to have a happy and healthy and easier pregnancy and definitely easier birth. I highly encourage to see a chiropractic care during the pregnancy, because those babies' spines and curves developing right in the womb, and we want to make sure that not only mom but this baby is also strong and healthy, and the pelvis is aligned, and the muscles and those ligaments that attach from the pelvis to the uterus are also in a good position, allowing baby to have an optimal position for the birth. So if you have any questions, find us on our website, allhealthykids.org, and this video is done at Healthy Kids and Family Chiropractic in Markham. God bless, and thank you, Natasha, for helping us out.